So she could take her own medication and everything?
Yeah, we would sort it out and give her medication. Yeah. And just like that, she died on me. And so I didn't know what to do. I closed her mouth, I closed her eyes, I straightened up her bed, I fixed her hair because I didn't want her family to, I called the family and I called Carolyn and first and told her, oh my God, because I took the stethoscope and listened for her heart. I did everything, before she was already dead. But I straightened out her sheets and then I took her hands and I made her look pretty for when her family got there. Then her family got there, and then once the family got there, her brother and his wife, they said, okay, call 911, and 911 came out and they questioned me like crazy. I was scared.
What did they question you about?
About how she died and this and that.
What did they ask you?
I can't even remember because I was like, no, like maybe I killed her or something. I said, no. Yeah, fuck you too. I don't know who he's fucking off. Exactly, yeah. And like, Ellie here had a trach. And then one fucking day, I'm taking care of her, she pulls the trach out. I'm not a nurse. Oh my God, I took that trach out of her hand and I yelled at her because I'm in shock.
Right.
And I stuck it back in her hole. I stuck that trach back in there. And then I think I called 911. Or I probably called Carolyn and told her I just stuck it back in. She says, that's fine. I don't remember. One time I had to call 911 because she was having an anxiety attack, but she didn't know that that's an anxiety attack. She was telling me she was having a heart attack. So I called 911 because I tried everything. I didn't call 911 right away. Sure enough, it was an anxiety attack brought it on, but she did have a little bit of a heart thing going on, and at that age.
See, and when you told me about how, like, when I asked you, like, if somebody, like, chokes or they need CPR, and you said, oh, they leave notes on the fridge where you got to call the family before 911. I'm like, see, I couldn't. Yeah. I don't know how you guys do that, or hospice, how you guys do that.
We have to follow rules.
And I'm like...
Or there's some, you call hospice and have the hospice nurses come.
But not 911. See, that's wild to me.
I know, but I guess the patient has a say in it too. Like, if you're mentally sound at a point, I think hospice does an evaluation. Well, I'm sure they do. They do an evaluation on you, and oh my God.
Right, because you have to be mentally fit to be able to make certain decisions.
You do.
Right, I understand. Well, I know that from law school. Yeah, that's why they don't let you sign documents after coming out from anesthesia and stuff.
Yeah, even a dental appointment.
But that's what I'm saying. But if a person is, deemed, oh, you're not mentally fit to make certain decisions, then if they are in pain and trying to get help and want you to call 911, and what if they change their mind and they get ignored?
I know, because I would like to have a DNR, a do not resuscitate, but only if it's a real life-threatening thing. If it's just a little thing like that, no, fucking save my life,
Or like, I don't know how you guys handle it when your patients die.
Oh, it's hard. It is so hard.
Like, I don't know what I would do if I had a patient and they died on my shift.
Yeah.
I don't know how anybody handles that. How does a person even begin to handle something like that?
When that lady died on my shift, I was, we had talked in the morning. I said, you want breakfast? And she was like, yeah. I said, you want pancakes? And she said, yeah. So, she was real rich, so she had real fancy maple syrup and stuff. And I was asking her, and I was out in the kitchen, and the kitchen was almost like hooked right to the bedroom because she lived in a condo. And next thing I know, I hear her gasping. I threw everything down and ran in there, and she died. She gasped for air, but real loud, and I had never touched a dead person before in my life. Not your grandmother, not your grandfather. And I told your grandmother, when she was alive, she would laugh and laugh. I'd say, when you die, I'm not kissing you and I'm not touching you.
What was wrong with her and to begin with? Like,
This lady?
yeah.
She had heart problems. She had heart problems, and she wasn't really that old. She was, if you would have seen her, she was thin, she was rich. She had, Carolyn would take her shopping. I never took her shopping, but Carolyn would say she'd go buy 2 or 3 things and it'd be like $3,000 or something. But she trusted me to iron her clothes. Her $1,000 white shirt. She had a $1,000 white shirt. And she loved it when I would iron her clothes. And then she'd wear this white shirt and pop the collar. And she had friends over all the time. I would make cheese balls. And one day I didn't know what to do. I made egg salad at home for my lunch, because there was all meat and stuff in there. It was a pretty cool layout. And so I made me egg salad, and I thought, well, I'll just take egg salad and crackers or something, and that's what I'll have, because that's the place that we stayed 2 and 3 nights, 24 hours a day. And she was having friends over, and she was up in the refrigerator, and the next thing I know, she pulled out my egg salad, and she had a tea party outside with her friends and served my egg salad. I cracked up laughing, because I thought, here's this rich woman.
So she wasn't even that sick, was she?
No, she just had heart problems. And that's why we were there.
Did she, so she wasn't didn't have to be on?
No, she was just like you and I, talking, blah, 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 blah. Her friends would come over.
So why did she need a caregiver for?
Because she had heart problems, and her brother did not want her there alone.